Hi everyone, my name is Dean Waisman and I'm President of Westech Cleaning Audit Systems. We've been auditing cleanliness in hospitals across Canada since the early 90s. As a result of this, we've audited hundreds of thousands of rooms over 2 decades, and in this experience, it gives us a unique perspective on cleanliness of Canadian hospitals.
What is the current situation regarding cleaning within healthcare in your country, and do you have laws that state what the cleaning standards are, or does each region have their own rules?
The Canadian healthcare system is very similar to that of the UK in that we have a national health system funded by the federal government. However, within our 10 provinces and 3 territories, each region is responsible for creating their own cleaning standards and for monitoring the quality. Furthermore, some provinces are much further ahead than others in this progress. And in my experience, the hospitals in some provinces as a whole are cleaner than other provinces. British Columbia, which is where Westech is based, is the only province at this time that has initiated an independent auditing program province-wide. In fact, since 2005, Westech has audited approximately 160 hospitals every year throughout British Columbia. In the first year we completed this task, 25% of the hospitals fell below the 85% acceptable benchmark score. And in tabulating the most recent results last week, only 6% of the hospitals fell below 85%. When we audit other hospitals in other parts of Canada that do not have the same kind of cleaning outcome standards and accountability that we have in British Columbia, we have found the level of cleaning to be much lower. While some provinces are ahead of others on monitoring cleanliness and adopting consistent cleaning standards, the awareness of how important the housekeeping department is to saving lives is now undeniable.
Is there enough money in the system to pay for high standards of cleaning, or do you have to really make the budget stretch?
As in other parts of the world, Canada is definitely in a situation where we really have to make the budget stretch in order to pay for the high standards of cleaning that are necessary to reduce the spread of infection and in turn to save lives. The 2 primary goals to ensure there is enough funding is to 1. Maximize the efficiency of the existing housekeeping departments and to hold them accountable with positive auditing programs, and number 2, we really need to educate the politicians as to the high cost associated with not properly funding the housekeeping department. Specifically, with poor cleaning standards, the spread of infection is not reduced, leading to longer recovery times in hospitals, which inevitably means more beds being used for longer periods and even death from hospital-acquired infections. The cost for inferior cleaning can be massive to families, hospitals, and in the eyes of public perception.
Do you find it easy to recruit and retain the right people for the job, or is this tough too?
Though Westech does not directly deal with hiring and retaining housekeepers, we understand from our clients that it is extremely difficult to retain the right people necessary to maintain the high cleaning standards with the current cleaning budgets. Moreover, it has been our experience that hiring the right contract cleaning companies and in-house workers directly affect the standard of cleaning in a given hospital. Cleaning companies and health authorities with a good reputation for treating employees with dignity and compensating them fairly will retain their housekeepers far longer than companies that don't. Housekeepers are the frontline guardians of our hospitals, both in public perception and infection control, and as such need to be treated with the respect they deserve. They are important to our healthcare system, and if they feel honored, their work will reflect the magnitude of the task we ask of them.
What are the key challenges at the moment for you in healthcare cleaning?
The key challenges at the moment for Westech is to continue to push for a Canadian-wide standard of cleanliness that will allow hospitals to maintain a higher rigor of health safety, as well as allow the public to have confidence that every hospital in every community, large and small, are held to a higher standard of cleaning.
What does the future hold for Westech?
Westech's focus has always been and will always be to establish a hospital cleaning standard in all developed countries. We are strong believers that every citizen should be confident that their hospital is doing its best to reduce the spread of infection through airborne and hands-on transmissions. We are mothers and fathers whose children have been in hospitals, and as users of our healthcare system, we are determined to ensure that every child in small towns and large cities gets the same standard of safety and cleanliness regardless of the size of their hospital. Westech will continue to work as an independent, objective, auditing company who has no ties to cleaning companies or cleaning products, and we will continue to work hard not only to audit the hospitals, but determine the specific areas where cleanliness can be improved. Thank you so much for this opportunity to talk to you about Westech's cleanliness auditing. Please feel free to email me or call me if you have any further questions or comments. Nigel will have my direct information. Thanks again.